Hello everyone, I'm Dr. Liu. Last class, we learned the manipulations of inserting needle, needling techniques, getting qi, and reinforcing and reducing methods. In this class, we will learn the retaining and withdrawing the needle, prevention and management of possible accident in puncturing, and precautions in acupuncture treatment. Section 9. Retaining and withdrawing the needle. First, retaining the needle. Retaining the needle means to keep the needle in a punctured point after the needle is manipulated. The purpose is to prolong the needling sensation and for further manipulation. Pathological conditions determine the retaining and its duration. In general, the needle is retained for 15 to 30 minutes after the arrival of qi and proper needling manipulation. Withdrawing the needle. The needle may be withdrawn after treatment. On withdrawing the needle, press the skin along the point with thumb and index finger of the pressing hand. Rotate the needle gently and lift it slowly to the subcutaneous level. Then withdraw it quickly and press the punctured point with a sterilized cotton ball for a while to prevent bleeding. Be sure not to leave any needle on the body. Section 10. Prevention and management of possible accidents in puncturing. First, fainting. Cause. This is often due to nervousness, delicate constitution, hunger, fatigue, severe diarrhea, loss of sweating or bleeding, improper position or manipulation, such as too forceful manipulation. Second, manifestations. During acupuncture treatment, there may appear palpitation, dizziness, fatigue, nausea, cold sweating, pallor, and weak pulse. In severe cases, there may be cold extremities, drop of blood pressure, incontinence of urine and stool, and loss of consciousness. Third, management. Stop needling immediately and withdraw all the needles. Then help the patient to lie down and offer some warm or hot water to the patient. The symptoms will disappear after a short rest in milder cases. In severe cases, press hard with the fingernail or needle 水沟、合谷、内光 and 足三里. Or apply moxibustion to 百会、气海、光源 and 涌泉. Generally, the patient will recover, but if not, other emergency measures should be taken. Fourth, prevention. For patients being treated by acupuncture for the first time, or those of sensitive individuals, a brief account of needling should be given to them prior to the treatment to relieve their nervousness. A posture for the acupuncture should be comfortable and the supine posture is adopted. Fewer points should be chosen and the manipulation should not be too forceful. Needles are not retained for a long time. During the treatment, if some prodromal symptoms such as pallor, sweating, or dizziness appear, management should be taken promptly. Second, stuck needle. Cause. This may result from nervous, strong spasm of the local muscle after the insertion of the needle. Rotating the needle with too large amplitude or in the same direction only, which causes muscle fibers to wind. or from a change of the position of the patient after the insertion of the needles. Sometimes, too long retention of needle may cause the stuck needle. Manifestations. After the needle is inserted, it is found difficult or impossible to rotate, lift, and thrust. If the needle is manipulated forcefully, it causes severe pain. Management. If stuck needle is caused by nervousness, temporary muscle spasm, ask the patient to relax and leave the needle in place for a while. Then withdraw it by rotating or by pressing the skin along the point or flipping the handle of needle or inserting another needle nearby to disperse the qi and blood and to relieve the spasm. If the needle is stuck due to excessive rotating in one direction, the condition will release when the needle is rotated in the opposite direction. If the stuck needle is caught by the change of posture, the original one should be returned and then withdraw the needle. Prevention. Nervous patients should be encouraged to relax. Manipulation should not be too forceful. Avoid puncturing the muscular tendon during insertion. Rotating the needle in only one direction shall not be allowed. During retention of the needles, the posture of the patient should remain unchanged. The third, bent needle. Cause. It may arise from unskillful manipulation or too forceful and fast manipulation so as to the needle strikes on the hard tissue, or a sudden change of the patient's posture, or the handle of needle being touched or pressed by something, or from an improper management of the stuck needle. Manifestations. It is difficult to lift, thrust, rotating and withdraw the needle, and the patient feels painful. Management. When the needle is bent, lifting, thrusting, and rotating shall be no longer conducted. The needle can be removed slowly and withdrawn by following the course of bend. If the bent needle is caused by the change of patient's posture, help him to resume the original position. Relax local muscle and remove the needle. Never try to withdraw the needle with force so as not to break and need inside the body. Prevention. Skillful insertion and even manipulation are required. Prior to treatment, patient should have a comfortable position. During retention of the needle, patient is not allowed to change his position as he pleases. The needling place shall in no case be impacted or pressed by external force. Fourth, broken needle. Cause. It may result from the situation as follows: poor quality of the needle or eroded base of the needle, too strong manipulation of the needle, strong muscle spasm or a sudden movement of the patient when a needle is being manipulated or retained, withdrawing a stuck needle or bent needle in an improper way. Manifestations. The needle body is broken during manipulation and the broken part is below the skin surface or a little bit out of the skin surface. Management. When it happens, the patient should be told to keep calm to prevent the broken needle from going deeper into the body. If the broken part protrudes from the skin, remove it with forceps or fingers. If the broken part is at the same level of the skin, press the tissue along the side until the broken end is exposed. Then remove it with forceps. If it is completely under the skin, surgery should be restored with the help of X-ray to find out the exact location of the broken needle. Prevention. To prevent broken needle, careful inspection of the quality of the needle should be made. Prior to treatment, reject the needles which are not conformity with the requirements specified. Never try to insert a needle violently. The patient's posture should not be changed during acupuncture. The needle body should not be inserted into the body completely, and a little part should be exposed outside the skin. On needle insertion, if it is bent, the needle should be withdrawn immediately. The fifth, hematoma cause. This may arise from injury the blood vessels during insertion, or from no placing of the point after withdrawing the needle, or the tip of needle is damaged like a hook. Manifestation. Local swelling, distension, and pain occur after the withdrawal of the needle. The skin of the local place is blue and purplish. Management. Generally, slight hematoma may disappear by itself without management if the local swelling, distension, and pain are serious. First, place it or apply cold compression locally to stop bleeding. Hot compression can be applied to promote resolution of the blood stasis after bleeding completely ceased. Prevention. Prior to needling, the needle should be carefully inspected. Avoid injuring the blood vessels during needling manipulation, and points are placed with sterilized cotton ball as soon as the needle is withdrawn. Section 11. Precautions in acupuncture treatment. Due to the conditions of biological function and the human body and the environment, these aspects must be paid attention to during acupuncture as follows. It is advisable not to give acupuncture treatment to the patient who is either hungry or overeaten, drunk, or too nervous. For very weak patient, the manipulation of needle should not be lasted for too strong, and supine posture of is preferable. It is contraindicated to puncture point on the abdomen and lumbroscular places for pregnant women or the patients that may cause contraction of the uterus, such as 合谷、上阴交、昆仑, and 至阴. In the period of menstruation, if it is not for the regulating of menstruation, acupuncture treatment is not suggested. Okay, this class is over. That is all we learned about the acupuncture techniques. Thank you for listening. Goodbye.